So I will turn it over to Kelsey. Kelsey Allen is our speaker today, and oops, I'll let you do this, Janet. You're better at that. And I know Kelsey. She works at Eat Smart, Move More, South Carolina, and so I've had the opportunity to get to know her a little bit over the past few months. Um, and so I'm pleased that she's here and going to talk with you today about what she does and some opportunities for working with coalitions. Great. Well, Kelsey, I'm going to turn it over to you and let you take it from here.
Okay, great. Okay, so everyone can see my slides, right?
Yes, they should be able to see your slides.
Okay, cool. Um, okay, well, thank you so much, Kelly and Janet, for having me today. I really appreciate it. Like Kelly said, my name is Kelsey Allen. I am the community coordinator with Eat Smart, Move More, South Carolina. And yeah, I'm going to go ahead and tell you a little bit about kind of what I do and kind of how it relates to community engagement and coalition building. So to start, Kelly asked me to share a little bit about kind of my who I am, how I got here into this job and everything. So I'm originally from Ypsilanti, Michigan. It's a small town in southeast Michigan. And I went to undergrad at Michigan State University. That's me and my friend kissing Sparty right there. And studied nutritional sciences and Spanish at Michigan State. And then from undergrad, went straight to grad school at the University of Pittsburgh. And there I studied behavioral and community health sciences. So I got my master's in 2012. And my first experience in public health was with an organization called Basic Health International. This is their little logo right here. I was an intern there when I was in grad school, did my practicum with them, and the work that they do is cervical cancer prevention for women in Central America. And if you've never read or learned anything about that topic, it's really fascinating. Cervical cancer is largely preventable disease with proper preventative screening protocols. So in the US, it's not as common. The diagnosis might be common. Pre-cervical cancer is fairly common, but death from cervical cancer is very uncommon in the U.S. because of our preventative health programs. However, in developing countries, that's not the case. So I did some research and things for them, and it was great. I had a great experience with them. It was a very small nonprofit. There was three of us in the office, so I got a lot of really good experience that way. Any questions that I had or ideas that I had, the person kind of at the top of the chain was, sitting right next to me. So I could often get feedback immediately, and it was really, really good for me. And I've always been interested in global health. I thought that that's the route that I was going to go in my career, but had some personal things come up, personal health issues, and I'm actually not able to travel to developing countries because of some of health issues that I have. So I thought I'll go ahead and keep doing this. I love global health. I'm going to go ahead and do it, but quickly learned that it's really hard for me personally, for my personality, to stay motivated in an office by yourself and not get to see kind of the impact that you're having in the community that you're working in. So that was really the first time kind of coming to that realization that I thought, maybe I should shift my focus instead of to global health to working kind of in the community, kind of on the ground in whatever community I'm living in. So um, I moved back home after I graduated to Michigan, lived with my sister, and did that thing that you do when you graduate. And I applied and I applied and I applied for all the jobs that I could. But I would say one little tidbit of advice based on my experience is when I graduated and moved back home, I left my entire network of connections in public health, and it's really hard to get a job kind of cold turkey. So I got interviews, but was very often or always passed over for somebody with more experience than me. So about 6 months of that, of being only part-time employed with Basic Health International, decided I was going to cast a wider net and apply all over the country. And whatever job I got, I was just going to take it and move there for a year and then move back to the Midwest with some experience under my belt. Um, and yeah, it's been 4 years and I'm still here. So that's not exactly what happened, but I've kind of taken a different path and that I'm grateful for. So I ended up working for South Carolina Department of Health and Environmental Control, or DHEC if you're from here. My first job was actually with WIC, so Women, Infants, and Children program. If you're not familiar, it is similar to like the SNAP program, but includes nutrition education. So as a public health nutritionist, I worked with counseling mothers of young children and ages 0 to 5 on healthy eating and healthy pregnancies, breastfeeding, things like that. So definitely addressed that issue that I felt with basic health, in which I was very disconnected from the community that I was working to serve and improve the health of. I was connected every day with that community. So it was a very good experience for me. I loved every day interacting with the people, with the public, and really getting an understanding of the community that I was living in and the community that I was working to improve their health. And however, in that process, also quickly learned the limitations of that kind of one-on-one individual approach to health, which is not to say that, of course, education is very important. Raising awareness is very important. Doctors, nurses, that one-on-one care is very important. But the part that I am most interested in personally is, when the mom that I advise to, let's say, walk 20 minutes a day for 3 times a week to control her pregnancy, her maternal weight gain, when she leaves the clinic, how does she achieve that goal? What barriers are in her way? Does she have sidewalks that are safe to walk on? Does she have transportation to get to a park that she can use for free? Is she near a school? Does that school have fences around their playgrounds, or can she go use it for free with her kids? Those sorts of questions that are a little bit, I think of them as kind of like zoomed out. So at the WIC, my job with WIC, it was very zoomed in. It was one-on-one conversations and counseling, and I was really interested in zooming out a little bit and looking at how those individuals fit into the community at large and how their community influenced their health. So an opportunity came up for me within DHEC to move into a role as a health educator, which doesn't sound that different from WIC, but it was. It was part of the community systems team. So I worked out in communities, doing tobacco prevention, promoting healthy eating and active living, cancer prevention, all sorts of different public health topics, and loved that job. It was great. I worked very closely with people who had been in the field of community health since I was born. Literally, one woman that I worked with, her career started the year that I was born. So such a good experience for me. I learned so much there, and then an opportunity came up last fall to work for Eat Smart Move More South Carolina. And always in my job at DHEC and community health, my favorite part of my job was working on the ground with local coalitions. That was my favorite thing that I got to do. It's incredibly rewarding, and I felt like it really lent to my education and my strengths. So this job came up with Eat Smart Move More, and the job description was community coordinator, in which I would provide technical assistance to coalitions across the state. And I thought, I would get to do my favorite parts of my current job all the time. So I applied and accepted that position this January. So I've been with Eat Smart Move More South Carolina for about almost 6 months now. Okay, so I'm going to tell you guys a little bit about Eat Smart Move More South Carolina and what it is that they do, what we do across the state. So our mission is to advance community-led change to reduce obesity by making the healthy choice the easy choice for every South Carolinian. And if you're not familiar with kind of that phrasing of make the healthy choice the easy choice, these pictures I think kind of help to show kind of the shift that we're trying to see. So these pictures are just examples of the way that our communities are built and how they're not built to make being healthy easy. So on the top picture there, here you can see all the different fast food restaurants here. You know, it's not signs for fresh produce or the local farmers market. It's signs for Burger King, McDonald's, Taco Bell, and sort of the other big picture here is that our communities are designed for cars, not for people. And then down here you can see a few people trying to walk on the road, and it's clearly not designed for them. Again, it's really designed for cars. And then another example over here of a concession stand. I don't know. I mean, surely you guys have visited a concession stand before, and there's almost never a healthy option there. So, in our everyday lives, it's very difficult to find healthy options. You really are swimming upstream to try to be healthy. And so it is our kind of big picture goal to see that healthy choice become easier and more accessible for all people in South Carolina. And the way that we do that is by taking a policy systems and environmental change approach. And that is important because for many reasons. So one is kind of the viewpoint that I mentioned it before, and kind of the difference between my job at WIC versus my job now is that we're looking at kind of population-based health versus individual behavior change. And we do that because it tends to reach way more people. One policy can affect an entire county, an entire city, sometimes an entire state, or the entire country if we can achieve those goals. And then policy systems, environmental changes also tend to reach disparate populations and address health equity kind of inherently. And then they're more efficient, more cost effective, they focus on prevention, and they're more sustainable. So oftentimes those are the effort that you put in to create a policy systems or environmental change has a longer lasting effect. So we have limited resources, time, and energy. So the PSE approach helps us to make the biggest impact without limited time, energy, and resources. And additionally, it tends to be a more upstream approach. And by that I mean kind of looking at the things that will cause chronic disease and obesity and getting up ahead of them to prevent them in the first place. So, and then on here also is the socio-ecological model, which I think is important to show just to show and mention that obesity and chronic disease, the pathology of those things are complex. It's difficult to address them. There's no one quick fix for it. We really need a big picture, multi-level, multi-sectoral approach to addressing obesity and chronic disease prevention. So this was just to show kind of the importance of partnership. It's important across the board for community work, but with Eat Smart, Move More South Carolina especially, we're a staff of 6 people, so our partnerships are very important. We wouldn't be able to cover all the ground that we do without these partnerships. So we have over 2,500 partners statewide, agencies, businesses, organizations, churches, schools, communities, you name it, including the South Carolina Department of Health, Education, Transportation, and Agricultural. So again, just thinking back to that socio-ecological model, it takes so many different levels of intervention to be successful at this work, and our partnerships really allow us to be able to do that. Other partners include local Eat Smart Move More chapters and other local coalitions, whether or not they're an official Eat Smart Move More chapter. So the way that we kind of focus the work that we do in South Carolina is by looking at 3 main areas. So the first is youth engagement, the second is advocacy, and the third, which is what my main job is and what we'll talk a little bit more in detail about, is community action. Okay, so the first area of focus that Eat Smart Move More South Carolina has is youth engagement. And the way that we address youth engagement is through what is called the HYPE project. And that stands for Healthy Young People Empowerment. And what this is a curriculum that groups of youth will go through together, and they're called HYPE teams. And through that curriculum, they learn to become advocates for positive change in their communities. So, kind of thinking about getting the next generation ready to be those positive agents for change in their own communities and realizing kind of the power of their own voices. Um, and the Hype teams kind of culminate after they go through the curriculum with a photo voice project, and the project will then kind of develop into like something specific, such as a lot of teams will do like park improvement, park cleanup. We've had a team in Lawrence that did a walkability assessment, and then their project was to work with the city council to get a crosswalk for them so that they could get safely from their neighborhood to their school, and they would be able to walk more in their community. So depends on the hype team. They can do a lot of different things, but that's kind of the way that we do youth engagement with Eat Smart Move More. And then the next is advocacy. So advocacy is really important. We mentioned the policy system. I mentioned the policy systems, environmental change, and that policy piece is challenging and it's really important. And through advocacy, what we do is mobilize local and state partners to create policy systems and environment that support healthy eating and active living, and that kind of helps to create space for kind of other levels of initiatives, if that makes sense. So some of the types of policies that we would promote are like healthy school foods bill. So there's a picture there of a child at school lunch in Greenville, so making school lunches healthier through policy changes. Open community use, if you're not familiar with that, it's a policy that a school district can put in place to make the school grounds open for the public to use after and outside of school hours. So really simple policy that can really make a big difference and increase access to places to be physically active. So that's another thing that we work on. And then third, again, this is really the biggest part of my job. We all do a little bit of everything, but I'm the community coordinator, so community action is really the majority of what I do. And through that, we work to build and empower local coalition efforts to create sustainable change in healthy eating, active living options for all residents. So what that model kind of looks like for us is, so we have Eat Smart Move More South Carolina, the nonprofit organization, and then there are local chapters throughout the state. As you can see on this map here, all of these little logos here show where there are Eat Smart Move More coalitions across the state. And actually, since this map was made, we have more. So I believe now we're up to 31 counties covered of 46. And then the stars here show other local coalitions that we work with that aren't necessarily an official local chapter. So my job, I live up here in Spartanburg. I'm a regional staff member, and I cover 12 to 15 different coalitions. So all the way here, Newberry, Fairfield, Lancaster, all of these up in this region would all be mine. So I attend their monthly meetings, offer them technical assistance, training, resources, things that they might need to be successful as a coalition. So the coalitions, kind of depending on the community, that kind of dictates who is at the table. So this is a picture of Eat Smart Move More Cherokee County Coalition, and different partners for each coalition can include faith-based organizations, schools, DHEC regional staff, YMCA staff members, local elected officials, community volunteers, and many, many more. So there's a lot of different partners at the table, and actually including there can often be people from, like, let's say the mental health field, or alcohol and tobacco prevention. So it's really, I mean, anyone can be a part of these coalitions. Um, it's just basically anyone who cares and to be a part of it is welcome to participate. So hospital staff, all sorts of people that come to participate in these. And then one last thing that I wanted to share about Eat Smart Move More South Carolina kind of as a whole. It doesn't fit necessarily perfectly into one of those three focus areas, but a few years ago we started to develop a resource called letsgosc.org, and that is our consumer resource in which we have, you can type in the community that you live in, your county or your city, your zip code, and find healthy things to do in your area. So if you want to find something fun to do with your family over the weekend, but you don't want it to include, carnival food or whatever, this has on there like local farmers markets. It has trails, parks, roadside stands, all sorts of different things. And it's good as it is. It's effective and has a lot of data on it. We are working on kind of overhauling it. So this August we will relaunch and it'll be a little bit more user friendly. But if you haven't ever checked it out, I would encourage you to go take a look at it. We're also on social media as well. So please feel free to check us out if you want to know a little bit more about that resource. Okay, so what I really wanted to spend most of, I guess, the talking about is kind of what my job looks like. And it's sometimes difficult and feels a little abstract to explain to people what my job is, other than I help coalitions make their communities healthier. But what does that really look like? And like I mentioned before, I work with 12 to 15 different communities. I attend all of their meetings, and they're all sort of at different stages in their life as a coalition, would say. But some of them we really have started all the way from the beginning, and luckily it's fresh on my mind because Pickens is a brand new chapter of Eat Smart Move More. And so what I want to do is kind of walk through what it would look like to start kind of from scratch. What does it look like to start at the very beginning of creating a coalition, and kind of the steps that I walk through with them to create an effective and sustainable coalition. So hopefully this is helpful. Again, please feel free if you have questions or comments throughout to just go ahead and ask them. So the number one thing I would say for creating an effective coalition is to be sure to approach every community with the right mindset. So identify the gatekeepers and community champions in that community. That's going to be so key. Having somebody from within who's excited and willing to be sort of the mouthpiece of the initiative of Eat Smart Move More, let's say Pickens County, is really, really important. They have relationships and sort of a foundation to build from that you don't have as an outsider. So that is really important. The second one, this may seem kind of like a no-brainer, but it is really important to keep in the back of your mind. Every community and its members have inherent value and dignity. So the community of Pickens, for example, has both needs and capacity, and that's something that I always try to remind myself. Shirley, I know that Kelly mentioned that you guys have learned a little bit about community needs assessments. So we talk about the needs of a community a lot, but remembering that with all of the needs that you've identified in a community, that community also has capacity. So don't forget the worth and value and the strengths of the community that you're working in, and let go kind of that idea of this is a community that needs a lot of help and I'm here with all the answers and I know what's best for them. So kind of letting go of that and being open and receptive to some ideas and solutions coming from within the community. And then take the time to learn about the history and the culture of the community. If you do end up working in the community, it's one of my favorite parts of what I get to do is that I'm exposed to so many different, stories and cultures, and every county, every community is different in an awesome way. You learn so much about the state and also about yourself and your own culture and kind of what you believe and the way that you talk and the way that you've been influenced in your life. But it's important to keep in mind to be open to that and to be kind of self-aware of your own culture and your own kind of biases in that way. So, and I had one kind of example that I wanted to share in regards to this. So, one community that I'm working in right now in Spartanburg, there's a group that is interested in bringing a community garden to a food desert, a neighborhood that is in a food desert, which is a great idea. Um, and I ended up at the meeting and was kind of talking through this with them and what it would look like. And in that meeting, the first meeting, they haven't created the garden yet. We're just kind of starting to have conversations. And um, the person who had received the grant to bring the garden to the neighborhood in a food desert, he asked me, so how do we teach these people how to cook healthy? And hopefully that kind of picks at or pokes at your conscience a little bit, um, because that's a really good example of an assumption that you want to be aware of. So before you ask the questions like, how do we teach these people how to cook? Make sure you know the pathology of the problem before you rush in with a solution. So taking the time to really find out, again, what is the capacity, what are the true needs of the community before you rush in with the solution. If someone has an infection, they don't need Tylenol, they need an antibiotic. So taking the time to figure out really and truly what is going to be the right solution for this community is really important. Okay, and then the next one, which this should be familiar to you, I think, is start with assessment. So going in with the right attitude is important, and then starting the work that you do in a community with assessment. So the questions you want to pose are: what are the biggest health concerns in the community? What are the underlying factors? And those questions I would base on data. So you do want to look at things like the county health rankings and the CDC's databases. Local health department statistics are really important. As much local data as you can get, the stronger your case will be to move forward with an Eat Smart Move More chapter. Local data is really powerful and tells a really important story. So look for local data as part of your assessment. And then the third one there is: what do people in the community perceive, whether it's supported by data or not, to be the biggest health concerns in their community? And that's really important, that perception piece. It can often be a barrier. Addressing a perceived need sometimes can be the key to getting at the real, and when I say real, I just mean supported by data, the real needs and issues in the community. Sometimes you have to address the perceived before you can get to the real. An example of that, one of our hike teams, I can't think of what county it's in right now, I'm sorry, but there's a hike team that was working through the curriculum, and they had gotten to the end to do their photo voice project and wanted to kind of prioritize what their project was going to be. And in that process of the photo voice and prioritizing what their project will be, we always kind of guide them towards healthy eating and active living, right? Because that's what we do. That's kind of our big picture goal, is preventing chronic disease and obesity. So we were guiding them in that direction, but what kept continually coming up in that was gun violence and safety. So that was the issue that just kept coming to the surface and coming to the surface, even though we were trying to guide them towards healthy eating and active living. And the statistics, the data didn't necessarily support that gun violence was a huge issue for the community. However, a student had recently been shot and killed who was close to the group of students in that hike team. So that perceived problem, the perceived need of addressing gun violence and safety in their community was more important than healthy eating and active living. And so it is important not to ignore the perceived health issues or health concerns in those communities, because sometimes that is the key to building trust between yourself and the coalition and the community, to be able to move into other issues that maybe are supported by some data. So just something to keep in mind, that both of those are important, and a perceived barrier is just as able to prevent healthy living as a real barrier. So both looking at statistics and data are important, as well as getting that qualitative community input as well. Okay, and then the third thing I would say is to create a vision, mission, and strategic plan. So not every community or coalition that I work in goes through a formal facilitated mission, vision, and value statement process. Some of them just kind of adopt the Eat Smart Move More mission and vision, which is fine. But that is really important. It kind of helps to guide the coalition long term, and when kind of conversations come up as far as, should we go this direction, should we go this direction, it's great to have those sort of structures in place for a coalition so that you can kind of guide them back through, by bringing back out a mission and vision and value statement. So by saying, I love that idea that you're bringing up. Let's look at our mission and vision and talk about whether or not that this fits into it. And there's always a time to reevaluate that, but I think that that's really important. And then secondly, the next thing I normally do in a coalition would be to present evidence-based policy systems and environmental options for action and allow the coalition to prioritize. So very practically what that looks like is we have a list of options for action. It's not exhaustive by any means, it's just things that we know are evidence-based, and that a lot of other coalitions in the state are working on. We have the coalition kind of read through that. Sometimes I present some options and talk about what it would look like in their community, and then allow the coalition itself to vote and choose and prioritize what strategies that they're going to use to address healthy eating and active living in their community. So sometimes we do that by like a sticker voting kind of thing, or sometimes just if it's a smaller group, it can be an informal conversation. But that's sort of the beginning of a strategic plan. And then getting even more into detail there, the next thing that we would do is create action plans. So this is kind of similar to if you've seen or used logic models. It's a simpler version of a logic model that is a little bit more user friendly for somebody who didn't necessarily go to grad school for public health. So it's a great tool and kind of helps to show progress as the coalition is working. So and makes every strategy broke down by kind of actionable steps, and you can use that to kind of delegate to different people on the coalition. And Jenga. So this is one thing that I wanted to share with you that I hope is helpful if you do go into community work. So something that kind of came to an image that kind of I use in my mind and that often comes to me when I'm working in a community and we're working through choosing what strategies to use in the community. Sometimes a coalition will get really excited about a specific intervention or strategy. And I'll use the example of open community use. So open community use, again, that's when a school district will have a policy that says that the community is welcome to use the school grounds, including like playgrounds, soccer fields, track field, or track, what do we call that? Tracks, to use them to exercise outside of school hours. So open community use is one of the strategies that we promote. And if a community chooses that strategy and it doesn't go well, kind of the way that I would handle that. So in the game of Jenga, if you've played before, you probably have. The strategy tends to be that you kind of use your finger to tap on the wooden blocks and apply a little bit of pressure. And if you come up against a block that you apply a little bit of pressure and all that you feel is the pushback, and there's no give at all, generally you just keep moving along, right? So you just keep going until you come to a block that you apply a little bit of pressure and you feel a little bit of give and you push a little bit harder until you're able to pull it all the way through and put it on top. Um, and community work is similar to that. So if you're using a strategy like open community use, and you go reach out to a school and you're really excited about it, and the coalition's like, this is great, we're going to make this happen, and you go to the school and you reach opposition. You get there and there's just no give. No one wants to have a conversation with you about it. They want to talk about liability. You know, maybe they tried it one time and there was graffiti all over their playground and they don't want to even talk to you about it. Um, if you come into that situation and there's no give, only pushback, it's okay and it's not a failure to just move along to the next block. Because all the while that you're doing that, you know, playing that game of trying a strategy, you know, having experienced pushback and moving along to the next thing, all the while you're changing the landscape of the game. So just like in Jenga, the pieces that were really hard to get out at the beginning become easier as you push pieces out and the landscape changes. That's also true in community work. So um, keeping in mind kind of the big picture landscape and keeping that sort of long game in mind. This work definitely doesn't happen overnight. It's a little bit slow, and it can be difficult, but not sort of viewing those things as failures, but just keeping in mind that if a strategy doesn't go as you planned and you move along to another option and you're able to go ahead and make that happen, it's still a success. You are still changing the landscape of the community. And hopefully when you come back, when you circle back to that open community use or whatever the issue is, it'll be a little bit easier to push it through. And then number 4, it's important to track progress and celebrate any success. So all of those things that I mentioned in the previous number 3, as far as creating the structure of the group, those things are really important for a coalition to feel like, okay, we're not just here talking about issues. We're here, we've got plans, and we're doing stuff. We've got a big picture plan. We've got actionable items that we can all do, and to feel really like, okay, we've got this. We're making progress. But that being said, it can still be challenging. You know, obesity is a really complex issue, and there's a really good chance that we won't see sort of the statistical change in obesity prevention in those numbers shifting, hopefully declining, but maybe even just plateauing for many years to come. So how do you keep your coalition excited and motivated to keep doing this work when we don't see necessarily the immediate results? So it's really important to track your progress, no matter how small it may feel, and to celebrate your successes. So those action plans, very simple tools, but kind of showing, okay, our big picture goal here is creating a farmer's market that will accept SNAP and WIC vouchers. And, you know, we don't have that yet, but we've done 3 of our 5 action items underneath it. So we've got 5 interested farmers, we've got a location, we've got this, and we've accomplished these goals. Even though we don't have the entire strategy complete, we're making progress. Using social media to share what the coalition has accomplished, just publicizing the work that you're doing and making sure that people know that you're working on this. And then presenting at city and county council meetings, Eat Smart Move More chapters. We always try to encourage them to be connected to their local elected officials, but when they do have any kind of success and they are able to make some progress, it's such a good idea to go in front of your city and county council and to share the work that you're doing. And then lastly, partnering with local press. It's just really crucial, again, to get the word out and for people to know the work that's being done. Again, even if it is slow going, it's still progress. So maintaining engagement, and this can really be a challenge, but we have plenty of coalitions that do this very well and have been successful for many years. And it can kind of ebb and flow as, if we have one really strong leader and they leave, and the transition can be challenging. But we have coalitions that do maintain their engagement very, very well. And so one of the things that is really helpful to maintaining the engagement of a coalition is investing in the coalition leaders. So providing technical assistance to them, training and resources. Most of our coalition leaders are not public health experts. So that's something that I can do and you could do if you end up in this kind of work, is helping provide some just really practical tools for them, so that how to run a meeting, here's an agenda, here's how you take minutes, here's when you should do what as a coalition leader, training them, teaching them about policy systems and environmental change so that they can be the mouthpiece in their own communities. And we've seen this done across the state really, really well. And when the coalition leader gets that, when they get the big policy systems, environmental change piece, it's huge for the community. It's huge for the amount of impact that they can have. And then sharing resources with them. So at Eat Smart Move More, we've created several resources to give to our coalition leaders to help them to make their jobs a little easier, because they're volunteers. So we don't want them to burn out. We don't want them to feel like this is such a huge burden that they burn out in 6 months or whenever. So providing them resources such as those action plans, and the resource with all of the different options for action, trainings, facilitation training, school-based intervention trainings, all sorts of different things that we can help kind of support them in the work that they're doing. Secondly, revisiting your strategic plan annually, making sure that everyone is still on the same page and feels like their input has been heard. And that's really important, to make sure that everybody still feels good about the direction that you're going. And then staying on top of current research and best practices, as we learn more about obesity prevention and healthy communities, we want to always kind of stay on top of that, so that we're promoting and using the best kind of top of the line strategies to address these issues. And this is my favorite thing that I learned in grad school that I wanted to pass along to you guys, is always remember that your goal is to be unnecessary. So, as a community coordinator or community organizer, health educator, someone that works in community health, the goal is that you leave the community stronger and more empowered and more capable than when you got there. So you don't want the coalition to be so reliant on you that if you were removed from the coalition, that they would no longer be able to function. The goal is to invest in the people at the table so that they are able to do the work themselves, because that is really what makes community work effective, is when it comes from within. So it looks different in every community, and in some communities that's going a lot better than others, but that's always kind of the big picture, and that's always something that I keep in the back of my mind, that my goal is to be unnecessary, which is really bad for job security, but it's really good for community organizing and community growth and healthy communities as a whole. So just something to keep in mind if you do end up working in community health, is that you want to empower the community and the coalition to be effective with or without you. And that's what I got for you guys. So do you guys have